Good afternoon, everyone. This is the Public Health Department working alongside the Centers for Disease Control and Prevention, here to share an urgent update about a rabies outbreak recently discovered at the Northfield Sugar Plantation. Our message today is simple. Rabies is deadly, but it is also completely preventable when we act quickly and we work together. The story begins earlier this month when a plantation worker named Jorge became seriously ill. He developed a fever, confusion, and muscle weakness shortly after returning from travel abroad. Public health official investigators interviewed his coworkers and quickly learned that Jorge had likely been bitten by an infected animal before returning to work. The CDC laboratory later confirmed it. Jorge had rabies. It is a viral infection that attacks the nervous system and is almost always fatal once symptoms appear. Epidemiologists traced Jorge's movements on the plantation and found something important. The workers of Jorge shared his water bottle were also at risk. This discovery led to the event now known as Sugar Plantation Blues outbreak. Now we have Dr. Anaya Patel with more.
Hi, I'm Dr. Anaya Patel, CDC field epidemiologist that is here on scene. Public health teams have immediately gone into action as they've interviewed workers, reviewed medical records, and tested animals near the Northfield. Evidence has pointed to one specific area, the Northfield, where exposure risks were at their highest. Through this data, officials have confirmed that the disease is spreading through indirect contact, as infected saliva may have contaminated shared drinking containers. The goal here isn't to cause fear, but to act fast. Rabies is preventable, but only if people who were exposed are treated immediately. Now we will go live in Guatemala. We have a local farmer, Ruth Baskets.
Hi, I'm Ruth, a local farmer in the area. We never thought something like this could happen here. We work with animals every day. Now we're learning how important prevention really is. This outbreak isn't just about one plantation, it's about community safety. Each year in the United States, around 60,000 people receive rabies treatment after possible exposure. And most exposures come from bats, raccoons, or stray animals. In our region, 3 wildlife rabies cases have already been confirmed this season, the highest in 5 years. These stories remind us that public health starts at home, in our workplaces, and in our habitats. Back to you guys.
Hi, I work for public health. So what can you do right now to protect yourself, your family, and your coworkers? First, see a doctor immediately if you've been bitten or scratched by an animal, or if saliva from an animal got into your cut or your eyes or your mouth. Secondly, report all bites to the local health department. Fast reporting saves lives. Third, do not share water bottles, utensils, or personal items at work until the outbreak is officially over. 4, vaccinate your pets and your livestock. It's one of the most effective defenses against rabies. Lastly, seal up the gaps in your home and workplace, such as holes in the roof. This will keep bats and other wildlife from entering the space. The CDC and local health department will be offering free post-exposure prophylaxis injections and educational materials at the plantation clinic through the end of the month. Let's talk about how public health works behind the scenes to keep you safe through 3 core functions. First is assessment. Teams collect data, interview workers, and identified how the illness spread. This is how we learned the risk was linked to the Northfield and shared water bottles. Secondly, policy development. New safety rules were put into place at the plantation, mandatory bite reporting, rabies awareness training, and workplace hygiene policies. This protects all the workers, not just today, but in the future. Thirdly, assurance. The health department is ensuring everyone who may have been exposed gets treatment and that accurate information reaches the entire community through announcements like the one we're doing right now. Back to our host to finish things up.
Made me so sick to my stomach when I had that for lunch yesterday. So, hi. The Sugar Plantation Blues outbreak reminds us that diseases can appear anywhere, even in familiar places. But when we stay informed, act fast, and work together, we can stop them in their tracks. For more information on free rabies treatment, contact the Public Health Hotline at 555-555-3421 or visit your local clinic. Together, let's turn this outbreak story into a story of prevention, perseverance, and community strength. Thank you.